हेलो स्टूडेंट्स, वेलकम टू माय यूट्यूब चैनल। आज हम देखने वाले हैं ऑटोप्सी यानी पोस्टमार्टम केयर। इसमें हम कवर करने वाले हैं इंट्रोडक्शन, पर्पसेस एंड नर्सेज रिस्पॉन्सिबिलिटीज़ इन ऑटोप्सी केयर। तो चलो स्टार्ट करते हैं आज का सेशन। ऑटोप्सी पोस्टमार्टम केयर, शॉर्ट एंड ईजी नोट्स बाय मिस पूजा, नर्सिंग ट्यूटर।
Introduction. An autopsy, also called postmortem examination, is a systematic scientific examination of a dead body performed by a pathologist or forensic expert to determine cause of death, manner of death, natural, accidental, suicidal, homicidal, extent of disease or injury. Purposes of autopsy. A. Medical purposes. To find exact cause of death, to study progress of disease, to confirm or correct clinical diagnosis, to evaluate effectiveness of treatment, to help in medical education and research. B. Legal purposes. To investigate suspicious, sudden, or unexplained deaths, to collect evidence for legal cases, to assist police and courts in crime investigation. Types of autopsy. 1. Medico-legal autopsy. Done in cases of unnatural deaths, accidents, suicide, homicide, poisoning, burns, unknown identity, etc. Mandatory by law. Performed only by forensic experts. Consent is not required from relatives. 2. Clinical or pathological autopsy. Done to understand disease processes, helps in medical research and teaching. Consent from relatives is required. 3. Psychological autopsy. Done after suicide to understand mental state of the person. Includes interviews, records, and history, not a physical body exam. Indications for autopsy. Sudden, unexpected death. Death within 24 hours of hospital admission. Death due to accidents, burns, trauma. Suspected poisoning. Suicide, homicide. Unidentified body. Death during surgery or anesthesia. Death in police custody. Medical disputes or allegations of negligence. Contraindications of autopsy. Not absolute in medical legal cases, these apply mainly to clinical autopsies. When relatives refuse consent, highly decomposed bodies with limited value, religious objections. Nurses' responsibilities in autopsy case, before death or at time of death. Notify doctor immediately. Record time and circumstances of death. Do not remove tubes, IV lines, catheters in medical legal cases. Preserve clothes and belongings for police.
Before autopsy, ensure proper labeling and documentation. Fill death certificate, doctor. Prepare body for transfer without altering evidence. Wrap body in shroud or body bag for mortuary. Inform and support relatives. During transfer, hand over body to mortuary staff with correct ID tag. Maintain chain of custody, police involvement if needed. After autopsy, receive body from mortuary staff, provide body to relatives after police clearance, offer emotional support. Documentation. Nurses' documentation. Time and date of death. Condition of body. Items, tubes left in situ. Police information if medical legal. Time of body transfer. Autopsy-related instructions. Thank you for watching my video. For more to get easy and simplified notes, subscribe, share and comment this channel and click on bell icon to get notifications.